Hi everyone, it's Elise Kleckner. I am here to do my case presentation. All right, case presentation on sickle cell disease by Elise Kleckner. Who is our patient? Our patient is a 15-year-old African American boy. He stated that he just made the football team at his high school. Due to this, he has been under a lot of stress and strenuous physical activity and practice. The symptoms that he has been experiencing: dry, cracked lips, severe pain in his legs, feet, arms, and back. He's also has been running a fever for 2 days now with headaches. He also states that he is dizzy and very weak. Lastly, he has been very short of breath. Cleveland Clinic 2023. Relevant history. Mom was present for the exam, and it was found that she had had her son at home. And when she brought the baby to the hospital in the rural area that she lived in, very minimal tests were performed. A blood test was not one of them. Mom was asked about family history, and it was found that the boy's father and grandpas on both sides have sickle cell. This is not the first time that the boy has had these episodes of pain, but was never brought in until now because it was just chalked up to be due to growth spurts. Cleveland Clinic 2023. Physical exam findings were yellowing of the whites of his eyes. His pain level was at a 10, and he was also crying. His temperature was 100.2. He was also physically sweating. His blood pressure was 140/99. Pulse was 102. Respirations was 22, and his O2 was sitting at 89 on room air. The diagnosis. The diagnosis that I've come up with after performing the tests that I will go over next, the symptoms, physical exam, and history, I have concluded that it has sickle cell disease with active sickle cell crisis. The diagnostic tests would be ultrasound for blood clot in the left leg that was found. CBC, this would show up as positive for low health of the blood cells, as well as high WBCs showing infection. Liver function test, this was needed due to jaundice found in the patient's eyes and came back for declining liver function. Hemoglobin electrophoresis, this was positive for HbS, sickle hemoglobin. Sickle cell test was performed to double confirm the presence of the sickle hemoglobin. Type and cross transfusion purposes only. MRI done for the migraine to rule out other possible causes. This was negative. Kidney function test was conducted to check for kidney health, and this came back clear. Lastly would be iron studies to rule out any other form of anemia that could cause the symptoms being felt and seen. Cleveland Clinic 2024. Lastly is going to be treatments. We can do pain relievers such as ibuprofen and Tylenol, IV fluids, a monoclonal antibody medication that prevents the red blood cells from adhering to the lining of the vessels. Hydroxyurea makes the red blood cells more pliable and bigger in size. L-glutamine, an amino acid that prevents RBC damage, and Volextor. This medication stops the RBCs from sickling and adhering to each other. Cleveland Clinic 2024. Thank you guys very much for listening. I hope you enjoyed, and below are my references. Thank you.